The following episode contains upsetting content related to slavery, death, and medical experimentation. Please listen with care. When it comes to the medical field, two disciplines focus primarily on women: obstetrics and gynecology. What you might not know, much of gynecology was built on surgical experiments conducted on enslaved African women. Those experimentations were done by Doctor James Marion Sims, who has been called the father of modern gynecology. Sims conducted experiments on enslaved girls as young as 13 and women in their early 20s. In most of the historical writing, they have all been described as women. He was trying to find a treatment for vaginal fistula, which is damage that occurs in childbirth. It can cause urine and feces to leak uncontrollably. Sims' surgical experiments were conducted from 1845 to 1849. The use of anesthesia was first recorded in 1846, a year after Sims began the procedures. But he didn't use anesthetics or pain medication during the surgeries on the enslaved young women. When he later conducted experiments on impoverished Irish women, he didn't use anesthetics on them either. He would use it when he did the operations on a European royal and on white women. At the time, racist notions that Black people didn't feel pain were used to justify slavery. Arguments have been made that anesthetics weren't used at large back then, and that these young women desperately wanted the surgeries. The women he operated on were considered to be the property of the plantation owners and had no say in what they wanted or needed. In an interview with NPR in 2016, Vanessa Northington Gamble, a doctor and medical historian at George Washington University, said this: "These women were property. These women could not consent. These women also had value to the slaveholders for production and reproduction. How much work they could do in the field, how many enslaved children they could produce, and by having these fistulas, they could not continue with childbirth and also have difficulty working." What is known about Sims is there were times when his male assistants refused to continue the surgical experiments. Whether they were tired or appalled is uncertain. According to Deidre Cooper Owens, a professor in the history of medicine, Sims, quote, was abandoned by the two white male surgical assistants who worked with him. And so, like any other slave owner, he said, "Oh, let me train these women." Sims would make the other girls assist in the operations. It's been documented that they would have to hold down the one being operated on. Imagine the pain of being operated on without any pain medication. Imagine having to watch others endure that same pain, to be witness to the pain, and to also feel that pain. 3 of these young women whose bodies endured unimaginable agony laid the foundation for modern gynecology. They are named in Sims' writing: Arnaka, Betsy, and Lucy. Anarka was believed to be 17, and Betsy and Lucy were between the ages of 17 to 19. He spent many years operating on these 3, often repeating the same procedure over and over and over again. Anarka alone endured at least 30 surgeries. Today, Sims' legacy lives on through the surgical technique to treat fistula, the Sims position, which is used in medical examinations, and through the vaginal speculum he created, which is also known as the Sims speculum. Calls have been made by some to rename the speculum to Lucy's speculum. Lucy developed blood poisoning from one of the surgeries. In 1855, Sims established the Women's Hospital in New York. It was the first hospital for women in the States and one of the first in the world. So, how do we reconcile that history and what happened to those young women with the advances made in gynecology? How has a historical idea that Black people, quote, don't feel pain in the same way continued to play out in the medical field to this day? What is the Flexner Report? And what role did it play in banning people from the Black community in Canada to pursue an education in medicine?